Today I'm going to be interviewing Brianne Carter. She is our newest practicum level oral systemic educator at the National Network of Healthcare Hygienists. Brianne is a passionate hygienist. I am so excited to interview her today. She's from Oklahoma City, Oklahoma, and she will tell you a little bit more about not only her role as an integrated hygienist and how that got established, but also about why she chose to become a healthcare hygienist.
So I work at the Oklahoma City Indian Clinic, is where I'm at. And I was a clinical hygienist. I've only been here for about a year and a half. And I came on right when we got the grant to put an integrated hygienist over in peds. And then I just kind of started, my wheels kind of started turning. And then I saw this and I was like, well, there's so many missed opportunities, you know, with our OB women's health department. We've got a metabolic center for diabetic patients. So while we were having an integrated hygienist in peds, I started running the QI project or the capstone project to get us into pediatrics, or not pediatrics, but women's health, our OB department. And our doctor there was like very for it. He thinks it would be great. You know, one thing, if we can kind of capture the parents and get them into dental, then hopefully we can get the kids funneled into dental a little bit quicker too, and do more preventative care for these kiddos instead of them having to come in and have like full mouth restorations. Right. So how we kind of ran it was I would go over there like part days and see patients, or if I had a block, like an opening in my schedule, like a patient not show up, I would just kind of go over and kind of capture who I could while we were over there. And we did this for about 6 months and really realized like we really need somebody there permanently. So once our grant ran out, they hired me as the integrated pediatric hygienist. And then we've got another integrated hygienist that'll go to our pink team as soon as we get another clinical hygienist trained and ready to go.
And tell everybody what the pink team is. I know because you and I have been emailing, but.
Yes. So pink team is our women's health or OB team is what it is. All of our teams here are broke down by color. We have like turquoise, red, blue. We've got gray team, which is our metabolic center. So right now we're kind of in the process of getting into the metabolic center, which is our diabetic patients. And I've started doing like a dental questionnaire that they give to all their patients who come through there. Once again, just to kind of back up the evidence that these patients, you know, don't have a dental home, that they need somewhere, especially with, you know, their diabetics being, you know, more high risk. So our long-term goal is next to be able to hire an integrated hygienist to be in our metabolic center. And my long-term vision is to be able to have a hygienist in every medical clinic that we have within our facility here is what we're shooting for.
And you will achieve it. I have no doubt. Look how far you've come.
Right.
So Brianne, this is amazing. I have a few questions for you.
Okay.
Just to give whoever's watching this interview some more background. When did you graduate hygiene school?
I graduated in 2004.
Okay, so it's been a little while. You're not quite as seasoned as I am, being a grad from '97, but definitely it's been a little while since you went to school. And what made you decide to take the oral systemic educator certification program at this time?
Well, I just felt like it's always something that's kind of been in the back of my mind. The whole reason I got into dentistry was I had a bad experience as a child. I also had a patient when I was in hygiene school, a little pediatric patient who had never had his own toothbrush, and he had a mouthful of decay. And during that time, I helped get him into OU dental clinic, get his work done, and then get braces and that sort of thing. So it's always kind of been a passion of mine just to, you know, if the access isn't there, they're not going to get, you know, the care that they need. But I had been looking at it for quite a while and just trying to decide if I could fit it into my schedule. And I think it's been so long since I've been to college, just a refresher on everything so that I felt, you know, just a little more prepared when I was going into a medical clinic and not so much a dental facility.
That's wonderful to hear. Yeah, that was our goal, was that without having to go back to school or get a nursing degree, that hygienists felt more confident speaking to and collaborating with medical providers.
Yes, total 15. We have 15,000 for our whole patient base.
That was my next question. That's a huge patient base.
Exactly. We've got 3 full-time dentists. We just hired another one that's going to be coming on, I think, within the next month. And this one this dentist may go more in an integrated role kind of with us hygienists, and maybe plan some of her days to come over and be with us in pediatrics and maybe do sealants, if we can while the patient's there, just to kind of help streamline things a little bit better and make sure they're getting, the care that they need to get.
Yeah, that's wonderful. What does, how much collaboration with the other healthcare providers did you do during your practicum?
We did quite a bit. We
Okay.
actually, so when I was with the women's health team, I actually created like a flyer that specifically went over oral health for OB patients, expecting mamas, like if they were having trouble with vomiting. And then I specifically made up care bags that had, like something for the mom, but also something for the baby. We did little finger toothbrushes just to kind of start planting that seed of getting these parents thinking, when they have that baby, you need to start thinking about their oral health then. And then in hopes that we will actually have mom as an established patient by that time, so that she will also, bring her children here and get the care that they need.
True prevention, which is
yes,
our ideal,
yeah.
really. Yeah,
Yes,
that's fantastic.
yeah.
So
Yeah.
did you feel real confident then being part of this collaborative care team?
I actually did. I think it helped that Dr. Freeman, who's the main provider there, was very for it. I think he sees the need for it, and he sees the oral health conditions that his patients come in with. So I think for him, actually having a hygienist there doing, the oral hygiene instructions, doing the fluoride, helping facilitate those appointments of getting them into dental. One, it took one less thing off his nurse's, schedule that they have to do. But with us, I felt like we created a list of OB patients that needed to get in. So we were more proactive of making sure that those OB patients got seen, in dental. So I think he was very appreciative of the effort we put into it.
What kind of comments did you hear from the other healthcare providers that you were working with?
There has definitely been some other interest. I know the doctor that's in metabolic, has been over in peds for a little while, and he was like, when am I going to get one of you guys to come over here and help me?
That's what Catherine Martinez said when she started at Children's Phoenix, that she slowly but surely other providers were coming out of the woodwork going, when do I get to meet with you? That's fantastic to hear. Yeah.
Yeah.
Well, how exciting. So are you planning to take on one of these roles, or are you going to stay in your clinical hygiene role?
No, I'm actually I'm right now the integrated hygienist for our pediatric department.
Okay, perfect.
The lady that did it originally for about 6 months was done via a grant. So with us doing this, it kind of proved, that we could hire more, and now we have a salary, within the clinic. So I moved over to the integrated hygienist for peds in February. And then the hopes is that we will have our integrated hygienist that will go in our OB pink team department within the next 3 to 4 weeks. I'm kind of working on, it's hopefully pretty soon. I'm working on just an overall standardized plan. We want to see our OB patients not just once, but try to do education throughout their different OB visits. Just talking about the transfer of, the bacteria for cavities, and how kissing or sharing utensils and things like that could set their baby up for having cavities if their mouth isn't overall healthy. But we've kind of been working on that just to kind of have like a standardized, this is how we treat each patient, so that when you go in, you know exactly what you need to do and provide for that patient.
Yeah. So you're becoming a program developer like me.
Yes.
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 It is a fun challenge to our hygiene brains to create all these systems and programs, but it's so needed. And I'm so certain that that your clinic there is so grateful to have you, I'm sure.
Yes. It's probably, I was kind of getting burned out on clinical hygiene. So for me, it's kind of been like, I still get to do, dental, which I love, but also just help create that access for patients who otherwise might not have ever had it. So
yeah, it's prevention at a whole new level.
Yes, absolutely. Yeah.
That's fantastic. So how does it feel to know that 2 potentially permanent positions were created as a result of your passion for integration?
It feels pretty great, honestly, just to think that I've kind of helped start this trend, and hopefully it'll be something that we see, within all of our clinic and maybe other IHS facilities. Because I really don't know of any other IHS facilities that are that have an integrated physician. And to me, it's the perfect setup, just to have, all their care at one place. They can
Absolutely
come to the doctor and then go to their dental appointment.
So IHS is already much like a federally qualified healthcare clinic
Yes.
in the sense that everything is integrated and there's one software system, correct? One medical record system?
Well, we have Dentrix is what we operate in dental, but they are trying to figure out a way to integrate that a little bit easier, because that's one of the issues we have. We have to get onto the electronic health record side to see some of the stuff we need to see, but they're not able to access our records.
Right.
So that's kind of why we're important, because we are making sure that they're following up with their, their treatment that they need to have done, and just reminding them.
There has to be someone working on this, right? There has to be a software company somewhere who's got this almost ready. So that is definitely one of the main barriers that I'm hearing from a lot of hygienists that are working collaboratively. My last question for you is, what does it mean to you to be a healthcare hygienist? What does that term mean to you?
Not just treating the mouth, but treating the whole body. I feel like that's kind of where medical and dental kind of went two different directions. And I feel like it's so important to look at the whole patient, because usually what's going on with them medically, we're going to see it in the mouth before we see it anywhere else. So if we can take our education role just a little more seriously and, look at their health histories and really figure out what we're seeing health-wise might be what's going on with what we're seeing in the mouth.
Absolutely.
I'm excited to see where it goes. I think there probably will be a big need for integrated hygienists. So keep doing what y'all are doing.
Because we are healthcare providers and we always have been, but the general population doesn't think of us that way. They think of us as tooth scrapers. And so one of our goals was to raise awareness on just how educated and passionate we are. And we are licensed healthcare providers who can do a lot more for our communities than we're currently in most states able to. So as we see supervision laws start to loosen up and hopefully some software integration happen, this is a really exciting time. So thank you for your part. Yeah, I don't know if you even understand how integral what you just accomplished is for us as a profession.
Well, I've had fun, and I'm looking forward to it, and I'll try to keep you updated on what we continue to do here.
Fantastic. I'm going to send you one of these t-shirts.
Oh, awesome. Yay.
So, so I'll shoot you a message and get your address, but thank you so much. And I'm sure that whoever watches this interview is going to have questions for you, whether they're at IHS and they want to use your, program as a pilot. Is there an email address that we can give?
Yeah. My work email is my name, brianne.c@okcic.com.
Perfect.
And
so if anyone,
feel free to reach out. Yeah.
If anyone wants to reach out, you're open and willing, right?
Yep. Absolutely.
Okay. Fantastic.